So today we're going to talk about overdose deaths during the pandemic. Many of us have seen the headlines, but some people may not realize that many people with substance use disorder are being helped. And I was wondering if you both could talk about the work being done in hospitals, and particularly Ascutney Hospital and Healthcare Center's emergency department to help those with substance use disorder. Dr. Marasa, maybe start with you.
Sure. Catalyzed by Jill's energy and the work that she did, we have now a lot of our regional hospitals offer patients with opioid addiction medically assisted treatment. The VA, White River Junction VA, us, Dartmouth Hitchcock Medical Center, and Springfield Hospital, at least, are the ones that are involved with this. We've also extended through the Turning Point recovery coaches. Recovery coaches are trained substance abuse counselors that help get people through their initial phases and follow-up phases too of their treatment for addiction. And it doesn't just have to be opioid abuse. We also are a center, and I believe the other EDs are also centers for giving out Narcan in very easily used nasal spray, which if there's an overdose, almost anybody can save somebody's life.
We had a summit two years ago in 2018 to bring together people across the county from different disciplines to identify, people from EMS, police, legislatures, providers, people from counseling, mental health, and specialty providers in addiction medicine to identify, what the issues were and what the best opportunities were for us to band together to make a difference in our county. And it was a very powerful opportunity, which really changed the county. We were able to, implement, because of the connection and network that's been built, new programs. The foremost is what Dr. Marasa spoke about with the introduction of rapid access to medication through the EDs. And it's not just that piece, which is an important and critical piece. It's the connection that Dr. Marasa has built with specialty providers in the area, notably Connecticut Valley Addiction Recovery, because it doesn't just stop at the ED. He's been able, and this is unusual for EDs, he's been able to outreach and have a connection with his colleagues so that people are linked to not only the medication, but to therapy, counseling, and supportive services in care management and care coordination. Mm-hmm.
Right. And can you talk about the treatment, the medication assisted treatment? Now, this is different from the naloxone that people are given, to reverse overdose. They come into the emergency department, they get the medication assisted treatment. What is that and how does that work? And then going forward when they leave the department?
That's a great question. And I'll do it as succinctly as I can, because it's pretty much an hour or two medical lecture.
Right.
But what the Suboxone does is it partially, not fully, attaches to the same parts of the brain that the narcotics and opioids do. Mm-hmm. So what you have to do is actually wait till some of it wears off and that they're in slight withdrawal. Because if you give this drug while somebody is perfectly high, it displaces the drugs that are making them high and puts them into withdrawal. So they have to be in a state where they kind of need something to stabilize them, because they're used to having this medication. And their body, their mind, their soul, everything, their whole physiology is used to having this drug that they've been taking over time. When it's gone, they start to have withdrawal symptoms. Mm-hmm. What Suboxone does is it actually attaches to those areas of the brain that the drugs of addiction were attaching to, the opioids, and it makes the body feel as if the person's getting the opioids, but it doesn't make them high.
I see. Yep.
So, and there is a theory, and the longer I study and the longer I see, I truly believe it, that the drugs, I don't disagree that the drugs change the brain. The drugs do change the brain. Some people's brains are changed so much that if they don't have this medication that helps replace what they were on, they have very little chance of recovery. Mm-hmm. The good thing about it is this drug does not make them high. It does not prevent them from doing the work that they did before or learning new things or functioning perfectly normal in society. There's a stigma that says, oh, you're replacing one drug with another. You could say that methadone does that, but methadone also really doesn't make them high. It just prevents patients from going into withdrawal, which is not only really uncomfortable for a drug addict, but if there was a way to induce those symptoms in somebody that never had a drug problem, it would probably be one of the most horrible experiences they've ever had. So that's what these drugs do.
So these drugs help people feel okay, and they can continue them after they go to the emergency department. They are also connected with mental health therapy to help them with that aspect, and with a recovery community. So there's really a lot of support, it sounds like.
Yes, because there's a lot more to prolonged recovery and abstinence than just a pill.
Another thing, what were you going to say, Jill?
Well, I think that what we're doing is we're building compassionate systems of support when people are ready in a timely way. And one of the other pieces that Dr. Marasa has and the emergency department has made a connection with the recovery coaches, so that, you know, when someone comes in and if they want to talk to a recovery coach, they'll come in right then when they're in the emergency department, and they will contact them afterwards and follow up, and they will offer support. So it's that connection both with Dr. Lord and connection and Connecticut Valley Addiction Recovery, but also with the recovery coaches. So it's a multi-pronged approach to wrap around the person and provide them the best chance of support and success.
Right, and recovery coaches often have first experience themselves in recovery, so they really understand. They are very non-judgmental. And the other thing I wanted to ask you both, you're both in the medical profession. People, I think, sometimes hesitate to get help because they are afraid of being judged. And I know you can't speak for everyone, but I was just wondering if you could talk about your attitudes or your colleagues, other physicians, nurses, other medical professionals, about people who struggle with addiction. You know, just the mindset of many healthcare providers.
You brought up an extremely important question or topic, and that is stigma. We couldn't have even started this program without doing some really good consensus building, training, acceptance around substance use disorder. So, you know, Jill is a great model of this. I had to take on being a model for this. My leaders in the ED had to do this. And finally, in order to get this accepted, because this wasn't something that was normal emergency medicine mainstream treatment. Mm-hmm. And it took buy-in from virtually everybody to make this work. And I've just been very happy with the transformation, because I get to hear everything that goes on in the trenches, and I get to see the charts, and I get to see how people relate and help. But yes, you are right. If we had stigma and we didn't treat people with compassion and treat them as if they were human beings, as a person with substance abuse disorder, as opposed to an addict, a derelict, you know, a junkie, something like that, then this just wouldn't work at all. And we've really come around, and it's really even helped it's really even helped the satisfaction of our staff, that they know they can actually help somebody when they couldn't before.
Can I just say that it's substance use disorder is not doesn't care if you're young or old or rich or poor. It is, anyone is susceptible to it. And we can't fool ourselves to think that anybody is better than anybody else. If you go into a room, I think any room around, and say to the crowd, does anybody know anybody with substance use disorder? It's a rare room that you go into where people don't have a connection. So, we do need to break stigma for all of us and understand that we're all in this together, and we are all in this together. And I can say, with our infrastructure that we've built, with our partnerships with community partners, recovery coaches, with specialists, with the syringe service, with all of our community partners, providers, specialty providers, and primary care providers, with nurses, with teachers in schools, all of us working together for each other, and helping each other. That's where I think really we're getting there. I think we've made a significant change and built significant relationships and changed the culture of how we do work.